It seems like things are still stagnating. You have over 2 million people in Quebec right now that don't have a family doctor.
Quebec Health Minister Christian Dubé provided an update on Thursday about the progress the CAQ government has made since introducing major healthcare system reforms 2.5 years ago. This also comes as Santé Québec is set to launch December 1st. Dubé said he wants all Quebecers to have access to a healthcare professional by the summer of 2026 and highlighted improvements that have already been made in several areas of the healthcare system, including 17,000 more people working in the sector since April 2023.
I just want to make sure that each Quebecer, so roughly 8.5 million of them that have the famous plastic card, la carte soleil, we want them to be registered, affiliated to a GMF, to un groupe de médecine familiale.
Dubé adds that once registered, a request for a health service can be made, and that person will be assigned a health professional based on their need.
It will be decided by those people when the demand for A services is being requested, which professional should be doing it. If it's a doctor, that should be a doctor. If it's a pharmacist or it's a social worker, whatever they need.
Priorities of Dubé's health plan introduced in March 2022 included providing better access to a family doctor, reducing emergency room wait times, and improving working conditions for nurses.
Wait times are still high for people who are in crisis. I'll give you an example in psychiatry right now. People are slipping through the cracks. And people go to the emergency room for help, but they might not have enough space to take on those patients. So people end up going onto the streets, confused, take drugs, things like that, and it becomes a security issue for people.
Every time I need a doctor, I do a lot of efforts, and I end up by taking a plane and go to another country to see the doctor, especially when there is like emergency things.
I don't have a family doctor, so when I want or plan to look for one, I just go online, and sometimes I have to wait 3 months just to get an appointment.
It did not improve of the fact that if you have to go to Click Santé, to call, to get in list, and even to get a blood test. A blood test might take a month before you used to go to CLSC, wait in line, and then after half an hour you're gone.
We haven't really seen broad strokes of change in the healthcare system. What we've seen is stagnation.
In Montreal, Gareth Madoc-Jones, City News.